Please help me welcoming Dr. Ramos, California's Surgeon General.
Thank you. Good morning. Buenos dias. It is such an honor to be here with all of you during this Blooming Health Day. And I am so pleased to be in this amazing audience hearing some wonderful, wonderful ideas. Now, I'm here to help us rethink of how we're going to move treating illness to truly creating health. And you may be asking, well, why is somebody from California here if we are all here New Yorkers? Well, I want us to really use us as a model. Now, why do we have to stop and think about healthcare in terms of prevention? Well, one of the important things, and this is important as an obstetrician gynecologist who cared for women across the lifespan, is the reality that healthcare and our health doesn't just start in the healthcare setting. It starts in the communities, it starts in our schools, in our workplaces, in our places of worship, and then more importantly, it really is impacted by our access to transportation, access to food, access to money, to jobs, right? And I can tell you, when I cared for patients, there was oftentimes patients who would take the bus. I worked in East Los Angeles, and they would miss their appointment, or so we thought they missed their appointment. But in reality, what was happening was that the bus was late, or they missed the bus, or they couldn't find childcare to be able to come to the appointment. And these were the reality, these were the facts. And it wasn't that they didn't want to improve their health, it was the fact that they needed support outside of the healthcare setting. Now, California is the fourth largest economy in the world, and our population is the equivalent of 21 states. And we are one of the most diverse places on the planet. So we serve as a testing ground for what the future of health can look like. Not because we have all the answers, but because we are willing to rethink old systems and, more importantly, establish new partnerships. Today I want to share several approaches California has embraced to address some of the biggest health challenges and why I believe the future belongs to states and organizations willing to integrate healthcare, technology, prevention, and most importantly, community. First, in California, we have made prevention a central strategy. Prevention is central. It is not an afterthought. For decades, our healthcare system has largely been designed to respond once a person became sick. We have to understand that many of the most expensive and devastating health conditions begin years before. And this is what I saw as an obstetrician gynecologist. I would see that there was pre-existing diabetes, that there was high blood pressure, that there was depression, there was substance abuse. And all of that didn't start with pregnancy. It started way before. And we have to realize that all of these health issues and social issues are deeply interconnected. So in California, we have focused on a life course approach and understanding that experiences early in childhood impact lifelong decisions and lifelong health. And one example of that is work out of my office focusing on trauma and health, adverse childhood experiences. For those of you who are not aware about adverse childhood experiences, there's three big categories: abuse, neglect, and household challenges. And the household challenges include mental health, divorce, somebody in the home that is incarcerated, or there is separation in the home. These are things that many of us experience during childhood. But did you know that if we address these challenges in childhood early on, you can actually prevent mental health conditions by 44%. You can prevent the conditions. You can also improve and prevent diabetes as well as improve social outcomes, improve high school graduation. You also decrease smoking by 43%, drug abuse by 24%. And you may be asking, well, why is it that addressing childhood trauma can play that impact? And that was a question I asked. The simple truth is that when we are stressed, especially as a child or growing up, we want to change the way that we feel. And some of that involves drugs, substance abuse, smoking. For some people, it's food, right? And it happens over and over and over again. That trauma, it impacts not only your habits that impact your health lifelong, but also it changes your cortisol level, that increases the inflammation, that increases that whole life force impact. So California reimburses for adverse childhood experiences screening and provides support in the community, has programs that provide support in the community for adverse childhood experiences. But California also promotes positive childhood experiences, and this is the opportunity where we build in community to improve health. And what do I mean by that? We know that if there is at least one positive influence in a child's life that reinforces relationships, has a child feel like they're listened, they're cared for, that can actually mitigate all of the negative trauma in a child. It can mitigate. It's a dose response. So the more positive childhood experiences you have, all of those negative things from ACEs go away. But that's community, that's family, that's those in that child's life. So that's where we have that opportunity to escalate this nationally. Prevention is not only clinical, it is relationship. And that leads us to the second lesson California has embraced. That health systems alone cannot solve health challenges alone. If we want better outcomes, healthcare must connect with community. Now, we've increasingly invested in healthcare systems, public health departments, schools, community organizations, faith-based groups, doulas, community health workers, social organizations, because we realize that that is the key to success. We know when a patient leaves a clinic, their health journey has just started. And you would be foolhardy to think, as I was, that 10-minute appointment with a patient was really impacting their health. It was everything. 80% of health happens outside of the healthcare setting. It was everything that was happening beyond that one visit. It is a reality that maybe a patient's not going to be able to fill their prescription because they're going to have to choose between food or their medication, between clothes for their children or their medication. But that is a reality. Now, the other important thing is that California has also prioritized maternal health as a model for broader systems transformation. And this is intentional. So as an obstetrician gynecologist, I would be remiss if I would not use the platform of Surgeon General to focus on what I've been working on my whole career. And that is improving women's health outcomes and starting with a starting point of pregnancy. Now, we oftentimes think of pregnancy as a one-time in a person's life. Reality is that health started way before. There are more people who are choosing not to have children than there are that those are. So where do we start? That is that prevention piece. We need to make health front and center for all of our lives. And those who choose to become pregnant can then go into their pregnancy at the healthiest level that they can possibly be. It's a sad reality when we look at the data that shows that over 80% of maternal deaths in the United States are preventable. Stop and think. Let me say it again. Over 80% of maternal deaths are preventable. Moms are dying without the need of having to do so. And we know that Black moms are dying disproportionately more than white moms. We have a lot of work to do. We have a lot of work to do to improve the equity, to improve the outcomes. California has made major progress in reducing maternal mortality through data-driven quality improvement initiatives. Repeat, data. Data drives action. We cannot stop collecting data because it is that data that is going to direct us to assuring that what we're doing is right, and more importantly, to ensure that we're pulling in all of the trusted messengers that are needed for us to help improve those outcomes. In California, we have organizations such as the California Maternal Quality Care Collaborative that has helped us create statewide approaches to the most common causes of maternal death: hemorrhage, hypertension, sepsis, and obstetric safety. Now, we know, though, that protocols are not the only solution. We have to support the whole person. And this includes mental health, postpartum support, cardiovascular follow-up, and the community connection. What do I mean by that? Well, in California, we launched a campaign called One Small Thing, and I would encourage you to please join us in this. One Small Thing is an initiative launched out of my office that focuses on the fact that 62% of maternal deaths happen after a mom leaves the healthcare center. 62%. So we're losing 80% of moms. Of those deaths are unpreventable, and 62% of those deaths are happening when the mom leaves the healthcare setting. So where does that pull everybody in? Well, I hope that's where you're realizing, wow, what can I do? And that is what One Small Thing is. One Small Thing is a solution for you to say, what can I do for a mom? Because now you're the ones in the community. One Small Thing identifies the fact that over 40% of moms report isolation and loneliness. Those are the biggest non-biologic predictors to mental health disorders, depression and anxiety. So imagine what would happen if every one of us did one small thing for a new mom, like bringing food over, taking her to a doctor's appointment, or even simply saying, can I babysit the baby while you take a shower, right? Little things that really are overlooked. But most importantly, you would be the eyes and the ears to see and to validate how she feels. I've heard it so many times, already shared by many people who've heard of our campaign, that said it was the fact that my in-laws came to visit us that we went to go get care for my wife that we thought she had mastitis, but she ended up being hospitalized for 4 days for sepsis. It's that validation, that external voice. We can all be that one person that makes a difference in a mom's life. And here's the reality. When we help a mom, you're not just helping the mom, you're helping the baby, you're helping the family, the community, you're helping really everybody. So One Small Thing, it's a campaign. Please join us. Everyone can imagine, and I oftentimes share in California, all right, we're 40 million people, and we have about 400,000 births. Imagine the power of community, the power of support and connectedness if everyone cared for that one new baby, the one new mom. It would be transformative, right? And it would be from people who are there already in the lives of those moms. Now, another area where we are pushing forward in California is technology and innovation. Technology should not widen gaps, it should close them. And I heard the conversation, should community be included or excluded? Oh my goodness, this is an opportunity to reform how we really shape the direction of healthcare. Imagine if each one of our voices were included in the way that healthcare and innovation, AI, were integrated to help us, right? It's not waiting for somebody else to help us. It is we are part of the solution. And I am so glad that all of the coders are in the back. I heard that the coders are in the corner of the room and you're continuing to code. And Now, postpartum care is the time, again, where over 60% of the deaths are happening. The most common cause of death after having a baby, pregnancy-associated death, in the United States as in California, is cardiovascular disease. Heart disease. And I oftentimes remind folks, heart disease is going to, unfortunately, not only impact your life if you are pregnant, but you carry that lifelong risk forever. People oftentimes think, oh, I had the baby, my preeclampsia, my hypertension, it's gone, I don't have to worry about it. Quite the contrary. It's critically important to realize that you have that lifelong risk for future heart disease, and that more women will die from cardiovascular disease than they will from all cancers combined, right? So don't think that the breast cancer, the ovarian cancer, the colon cancer is going to kill you. It's going to be heart disease. So that's why we have to support moms, especially after having a baby, to get the healthiest they can be that first year. And what does that look like? That looks like connecting blood pressure to the healthcare provider, monitoring what does your blood pressure look like right now, and if there's a high blood pressure, to be alerted by the healthcare team, hey, she had a high blood pressure. You need to give her a call, make sure that it's accurate, and bring her in for care. You could save her life. And all of these AI-supported workflows can help teams focus on less on an administration burden and more on human connection. I've heard it from my colleagues, wow, that AI scribe has been so helpful. And patients are saying, my doctor's actually now looking at me in the face and not looking at the screen. Technology must meet people where they are, in their language, on devices they actually use, and in ways that they feel supported and not transactional. This is especially important in communities that have historically been underserved or excluded from healthcare systems. California has increasingly focused on integrating healthcare and social infrastructure because we know outcomes are heavily shaped by non-medical factors. Housing instability, food insecurity, transportation barriers, digital access, social isolation. These are not side issues, they are core to the health issues. And as healthcare moves forward, value-based care and accountability for outcomes, we need systems that can coordinate across sectors and not operate in silos. That is why gatherings like Blooming Day matter, because no single organization can solve these challenges alone. It's together. Government cannot do it alone, healthcare systems cannot do it alone, and community organizations cannot do it alone. Technology companies cannot do it alone. The future depends on partnerships, on coming together. And I believe we are entering a new era where healthcare systems will be increasingly judged, not by the care they deliver inside the clinic walls, but how effectively they connect people to support beyond that. The future of healthcare will belong to systems that are more connected, more preventive, more community-centered, and more data-driven, but more importantly, more human. California's experience has taught us that large-scale transformation is possible. If we can do it, where we align policy, innovation, public health, and community voices around shared goals, everyone else can do it. We still have a lot of work to do, but we must continue building systems where people can actually reach that care. Systems that are eager to navigate, systems that earn trust, so critically important, and systems that recognize health is shaped every day in every zip code. And perhaps most importantly, we must remember that behind every data point is a person. A family, a community, a story. Health is not simply about extending years of life. It's about improving the quality of those years, helping people thrive, helping communities flourish. That is the opportunity in front of us. Together, we are willing to work across sectors, rethink old models, and build solutions grounded in prevention, dignity, and human connection. I truly believe we can create a healthier future, not just for California or New York, but for the entire country. Thank you so much. And I am not sure if there are questions or if we have time for questions.
We do have a question for you, Dr. Ramos. Where do you see the biggest disconnect today between healthcare systems and community organizations? What would better alignment look like?
So I think the biggest disconnect is obviously in connecting patients to the resources in the community. And what do I mean by that? That short visit with the provider is oftentimes not followed through with what is available in the community. You can say, well, you need to increase your walking, you need to increase or improve, eat more fruits and vegetables, but where do people go? Where do you start? And I think that connection is a simple first step that we can all improve.
We do have one more. As we think about maternal health and health equity, how can technology improve connection and access without replacing trust and human relationships?
So first of all, I think we need to establish trust, right? Without trust, you can have the prettiest, shiniest solution, but nobody is going to trust that that actually is something for you. They may think that's something and created for somebody else. So we need to establish trust. And what do I mean by that? Well, it could mean a doula, community health worker. It could mean somebody, your pastor, your grandmother, your aunt, right? And once we have trust, then we can connect and share the technology, the apps, the websites that provide the trusted, validated information to that person. And I think education about health is so critically important in order so that for you to be able to advocate for what is right, for what is available, and for what you know is going to work for you.
Thank you, Dr. Ramos. Please give a round of applause for Dr. Ramos.
Thank you.
While we do a quick transition, we'll be having Eva, the CEO and co-founder of Blooming Health, coming up for the Innovation Showcase and live demo. Don't miss it, we'll be back in 1 minute.